Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Renal and the ureteric calculi, and we are looking at the management. So first, when you look at the renal calculi, here there are three categories. So each of them have their respective management. So if it is less than 0.5 centimeters, so then there is a conservative management. Second, if it is 0.6 centimeters to 1.5 centimeters. So in this case, we move on to the ESWL. So ESWL, it stands for, let's write it down, it is extra corporeal shock wave lithotripsy. Shock wave lithotripsy. Now, moving further, so in terms we spoke about the ESWL. So in case it is, if it is CI, if it is contraindicated or if it fails, then what is the procedure? Next, we move on to the URS. So we can do a URS or the PCNL. So in case the URS or the PCNL, if it fails, then what is the procedure? So in case if it fails, then there is the open or laparoscopic. You do open or the laparoscopic pylolithotomy. So pylolithotomy or the nephrolithotomy. Now, the last condition is where, before we move on to the last condition, let's look at what is the full form of the PCNL. So PCNL here, it's nothing but the percutaneous nephrolithotomy. Percutaneous nephrolithotomy. Next, what about the URS? The URS stands for the ureteroscopic retrieval of stones. Retrieval of stones. So now we move on to the conditions. So we saw less than 0.5 up to 1.5. Now we are going to look at greater than 2 centimeters. So when it is greater than 2 centimeters, you directly do the PCNL. There's a percutaneous nephrolithotomy. So in case this fails, so in terms this is failing. So if it fails, what we do is we open our laparoscopic pylolithotomy. So you perform an open or laparoscopic. You do open or a laparoscopic pylolithotomy or the nephrolithotomy. Next, this was about renal calculi. Now we look at the ureteric calculi. So under ureteric calculi, it is just two divisions, that is, in terms it is less than 0.5 centimeters. So here you do CM, conservative management. Next is when it is greater than 0.6 centimeters. So here there is two things, that is non-impacted, you're writing it as NI. So in non-impacted, you do the URS, that is ureteroscopic retrieval of stones. And in case if this fails, then you do the ureterolithotomy. And in case this 0.6 centimeters, it is impacted, then you directly move ahead with the ureterolithotomy. To learn and grow daily like this, please do subscribe.